the host of Teens No Cap. I'm a licensed mental health counselor specializing in the treatment of teens. And today we're talking about a very important, I think, like pervasive issue, maybe even in our teen culture, understanding chronic illness and working with teenagers and different populations. So, Destiny, do you want to introduce yourself? Tell us about you.
Yeah, definitely. I'm a therapist in Atlanta, Georgia. I'm a licensed professional counselor and a certified rehabilitation counselor. So my master's was all in counseling for people with physical and mental disabilities. It's really important to remember that depression, anxiety is considered a chronic condition. So when we're talking about chronic health conditions, we're also looping in some of those mental health disorders. But yeah, I have a private practice here in Atlanta. I'm licensed in Florida, Colorado, and Georgia, and I'm really excited to be here.
And so you give us the background on like the chronic illness piece, because obviously we'll get into like all of like why this is important, but give us the background for you.
Yeah, well, for me personally, I grew up with, I've talked about this a few times, but I did grow up with a mom who was like chronically dismissed by the medical system. So it was a lot of like, you're just being dramatic, you are, there's nothing wrong with you. Meanwhile, every year, like year after year, she was gaining more weight and having more symptoms. And it was always chalked up to her weight. It was always like, you just need to lose weight rather than understanding that the medical conditions she actually is struggling with was the cause of the weight gain, which I think medicine is finally starting to catch up with. But mainstream media, like, or mainstream, still doesn't like to like go there because it's not as easy as a fix, right? It's not as easy to, it's much easier to say if you just lose weight, you'll feel better.
It's so easy to blame the person, not the problem.
Exactly. Yeah. So yeah, I grew up watching that, and then when I became an adult and started having my own chronic pain, I was like, "Oh, well, I guess this is just like my mom, and I'm like if she couldn't get help, then I'm not going to be able to get help." And I just kind of didn't go to the doctor at all, and I mean, this is probably a whole other episode, but I went down like a rabbit hole of holistic care and like evidence-based practices and things like that because Western medicine it didn't have anything to offer. I've since really done a 180 and I'm on the complete other side, but that's not like a I think that has to do because a lot of the Western medicine is catching up to some of the lived experience that we all have been experiencing for a while. You do have to search it out. It's not like you can just go to any doctor and they're going to just automatically validate you and now look for this kind of, thing that is truly going on with you other than, what's causing the weight gain rather than weight gain being the issue. But yeah, that's how we got here in a nutshell.
I love it. Well, and I'm so excited that you were open to coming on and talking about teens, because I know, like, as someone who works with a lot of teens, we know that there are a lot of co-occurring conditions. And when I think back to like my training in grad school, obviously one of the first things they told us was like, before you start treating someone for something, make sure they've had a full medical workup, make sure they've like been medically screened, right? Like, we don't always want to jump to the case of like, oh, this is anxiety, there's nothing else wrong with you. It's really interesting how that experience has kind of gotten to the place where I think there are a lot of people that are like, oh, I'm just anxious, I'm just this, and we skip the medical part altogether.
Not to mention, I mean, people do go to the doctors now and they still are told nothing's wrong with you. And so that just really exacerbates the problem. Even when we are diagnosing there's 3 or 4 different diagnoses in the DSM that basically mean you're making it up. And that, like with physical health symptoms, like somatic symptom disorder, conversion disorder, health anxiety disorder, and there's one other one. And the problem is it takes 7 to 10 years on average for the average female to get a proper diagnosis. And I've worked with people who it's been 15 plus years. And in fact, if I'm looking at my own story, like I've never really been given I have had many different kind of working diagnoses, but I've never been given like, this is exactly what you're dealing with. And I'm going on 14 years. So yeah, it's a long journey. And I think we just can't even anymore say like, well, if all of your medical findings are clear, then we can chalk this up to anxiety. It's like if your stomach is hurting every day when you go to school, and I think that's one of the biggest ones, like parents and teens, it's like, my stomach is hurting. Well, anxiety does exacerbate stomach issues. And so even if it is anxiety, there's so much we have to work with there. Why are they anxious? What's happening for them at school? Like, we have to take that seriously. It doesn't just mean, I think people get so scared of validation sometimes because they feel like it then means, well, if I validate this, then I'm just supposed to let them stay home from school? No, not necessarily, although sometimes that might be the case, especially if they do have, I mean, if your kid is going to the bathroom 10 times a day, like that's excruciating. It's embarrassing. It's disruptive to their learning. That's hard. And so there's a lot of different things that we can do. And I'm not the expert on like the accommodation side of teen work. There are a lot of things that we can do. I will say our ADA laws are currently being quite dismantled, and so that may be changing. But as of right now, we still have laws in place that protect us, and it's really important to listen to your teens. It doesn't really matter if you like they are. I promise you, they're not faking a stomach ache. They the stomach ache is there now. Whether it needs to be a day off from school or not, that's a different conversation. So we always want to start with validation.
You know, it's interesting you bring that up because I do feel like that has been kind of a pushback in a lot of parents because they're so afraid of like, okay, if I validate this, then what?
Exactly. Yeah. And that's I think it's such black and white thinking. Like again, so again, if the child is literally going to the bathroom, so with each condition, we start to get like a pattern. We start to understand that maybe during certain times of the month, your child is going to the bathroom 10 times a day, and other times they're going a normal 1 time a day. So, what do we do then? How do we work with the school to get this child the accommodations that they need, or work from home, school from home options if that's available? Some schools, it's different in each and every school. I think the biggest thing here is like you validating or not validating doesn't change what they're going through. It just adds to the trauma of what they're going through. And so it might be, it is really inconvenient, especially in this country where we don't have a ton of paid leave, if at all. I know that like even when my own kid is sick with the flu or something like that, like that means if I don't work, I don't get paid. I don't have PTO. Like if I don't see a client that day, I don't get paid. So on the days where I have to, stay home with my kid, that is a struggle. That's a hardship. And it's also the reality of the situation. So each person has a different reality based on what their condition is, and denying that condition doesn't make that reality go away. It just actually causes more trauma.
Yes, and I would add to it that part of your validation as a parent or as a provider or as like another person that's kind of connected to this teen is actually helping them feel heard and helping them feel seen because the validation is like I get you. And then you're joining in with them instead of it just being like, well, your stomach hurts, it's your problem. You're joining in with them. And I know like one of the hardest parts of like chronic illness is the fact that it feels so invisible.
And isolating, yeah. Yeah, the job of the parents here is to learn distress tolerant skills for themselves because it is distressing when your kid is sick for a myriad of reasons. One, none of us want to see our kids sick. It hurts. It's miserable. Two, we might have to miss work, which means now bills are getting delayed. Like there's a lot of stressors there. And again, like I'm all for like some advocating for systems to change. I'm not saying that this is all the work of like mindset work, but I don't have answers for that part. So the answers that we work with is distress tolerance for now and advocating for change wherever you can. I've worked with people who have gone to their workplace, who have gotten flexible start times, end times for their workday. And us, honestly, COVID brought about this normalization of work from home. And I am noticing that a lot more people have more flexibility than they used to. That's not everyone for sure, and a lot of people are trying to take that back. But yeah, it's about getting creative, and that's where I think therapy can be really helpful, especially with somebody who understands chronic illness, because it's not just like, oh, we'll change your mindset. It's like change your mindset and look for the answers to support that new mindset. Look for sometimes we have to change jobs. Sometimes people have to stop working. And I hate that that's the case. Like, I'm not advocating that that's the easy answer. There was someone on my own podcast, Antonia Repollet. She talked about her experience with her mom, like, and how she basically did school from her bed for, I can't remember how many months, but many, many months. And she was diagnosed with either ulcerative colitis or Crohn's disease, but she couldn't go to school. And she was really, really lucky that her mom knew how to advocate in the school system, and that she got a tutor and was able to, I think through the school, and stay at home and do her schoolwork and not fall behind. So those are sometimes options and that's best case scenario. Kid doesn't fall behind. In worst case scenarios, they fall behind and they have to repeat the year. And that requires, again, a ton of distress tolerance from the parent. Because if you can't tolerate your own distress around it, then you can't teach your kids how to tolerate their distress around it. And now their therapy sessions become them figuring out how to tolerate their own distress and your distress. So it's a lot of work. It is, but this is the reality of it. Like there is no changing. We have gotten sick from the dawn of time, and we will continue to get sick forevermore, because sickness is simply a part of life. I think that's a really big mindset shift that a lot of people need to have in this country. I think especially right now, we have a lot of rhetoric around like, if you just eat right, if you just do right, if you will be fine. And that is just not the case.
It's just
Um,
magical thinking of it.
exactly. Exactly. If you walk the right amount of steps, if you eat all organic, if you, whatever it is, we all have these kind of rules. And there are lots of behavioral lifestyle modifications that can help a particular condition be less severe. But something like a connective tissue disorder is, you're born with that. And that messes up your gut, it messes up your joints, it messes up nerves. And there's nothing, unfortunately, that you can do to stop that from happening. And that requires a lot of distress tolerance.
Really kind of on both ends, right? Like on parents' end and on the client, the teen's end.
Hmm. Exactly. Yeah, and depending on the child's age and whatnot, the way that you talk about this with your child will look different depending on their age. But no matter what age they are, your distress tolerance has to come first. And I'm actually speaking as a parent here for those who are listening. I'm not speaking just as a clinician who has not gone through this. Like I am a parent, and yeah, even as a therapist, have had to learn how to do this myself as well. And I was a therapist before I was a mom, and I thought that would make it a lot easier. But you know what? I had a lot of learning that I had to, and I still have more learning that I'll have to do. But I just want to really validate that this is really hard stuff. And if it's hard, then you're human. You're not doing anything wrong.
Well, and there's no blueprint, right? When we think
Hmm.
about like chronic illness, when we think about like special needs, when we think about all those other pieces, there is no blueprint.
No, there's not. And that can be frustrating sometimes. So then sometimes people will like write a book or try to create a blueprint for it. But you'll quickly learn when you start to like download every free resource on the internet that not all of it applies to you, and maybe only 1% of what you're reading applies to you. And that's a part of your job, is to figure out which parts apply to you, and how do you absorb and learn kind of some of these new, sometimes it's a coping skill, sometimes it's a piece of medical knowledge, sometimes it's money management. The only constant in life is change. And so people kind of want this answer, this blueprint, but the blueprint will change even if you somehow gathered it's always going to change with each new chapter of life. Our job is to learn how to be flexible in that, go with the flow, move with it, and tolerate our distress again around it.
I don't know, Destiny, that's a lot.
I know. I think it's just we talk so much with teens about like their mental health, and I definitely understand not wanting to blame parents, but it's not about blame. It's, again, we're all just humans. And so I find it's my job to help my child learn how to tolerate the stress of the world. And I can't do that if I don't know how to do that for myself.
I talk about role modeling, and I just think it's such a huge component of like the parenting piece. And there are so many parents, and again, not to blame anyone, but there's so many parents who are like, do as I say, not as I do, or that lack like the ability to like have those reflective conversations and to really understand what's happening at the core. And you're totally right. Like, how are you going to help your teen experience and like really understand and sit with distress and like being able to tolerate that if like they can't do it, or they don't know what that looks like, or they don't know what that is, or they're like rejecting the idea that that could possibly be a thing for them.
Yeah, exactly. And I mean, I think it's really important for parents to do this kind of self reflection work. A lot of times, what I see is parents will try so hard to fix the illness. So they'll like push their child into like new treatments, and it is our job to lead as parents, and to give them medicine and to take care of them, absolutely. But at a certain point and at a certain age, they really need to start making their own decisions in collaboration with you. You scaffold that. I always give the example of tying a shoe. First, they watch you, then they do it with your hands on top of theirs, then they do it with you watching them, and then they do it alone. And that whole process can take 3 days or 3 years. Like it just changes from kid to kid. So that's another, I think, tip for parents listening is to look back at your child and how they learned other things in their life, brushing their teeth, putting their shoes on, doing their homework. Like what was that process like? How hard was it for them? Did they learn it fairly quickly and were they really good at watching and modeling you, or did they need a lot of redirection, or like what is their pattern as a little human? That's probably going to be their same pattern with how they react to and learn about their illness. So it's understanding your own reactions and how you learn and move through life, as well as your kids' reactions and how they move and learn through life.
Well, and I think you bring up a great point for parents and for providers and other like therapists and coaches and counselors that are working with teens, because I do think that there is this kind of like blanket statement of like, oh, just be more mindful, or oh, like, just accept it, right? Like that's kind of the pushback. But I think back to like myself as a teenager and like the struggles that I went through and the trials that I had, and like I use that as a part of how to build like empathy and compassion for something that I may not totally understand, right? But like I think that's the part of like the therapist job, is really being able to be like, what is that experience truly like for you? And to really like dig into those pieces and not just like dismiss it as part of like, well, I'm not your doctor, right? So I can't do anything about this, right? And I think there is so much to be said for therapists, specifically teen therapists, that can join into that and be like, I hear you. I want to be part of whatever this needs to be for you in a way that is really centering your experiences and not just dismissing it as like, well, I'm not your doctor, so I can't do anything about it.
That's exactly right. We just did a training on countertransference. When you are a therapist and you're working with chronic illness, there's a lot of stuff that comes up for you as a therapist, and you just really hit the nail on the head. A lot of times, what people are therapists are scared about is like, am I moving into medical territory? Am I like practicing outside of my scope if I talk about this health issue? And I like to tell people, if you're starting to tell them like what supplements they should take and what diet they should do and things like that to try to fix their illness, then you're definitely practicing outside of your scope. But if you are trying to be in it with them, understand their experience, understand the hopelessness, get really in there and feel what it feels like, and then help them tolerate the distress around it, communicate what they need. There's so much room for therapeutic work here. Honestly, it's endless.
Is there a model, or I don't know, a theoretical orientation that you find to be kind of the most helpful or supportive of like therapists who are trying to do that work with clients in session?
Yeah, I mean, I move really much in the acceptance and commitment therapy world. So I'm an ACT therapist through and through. I think even ACT can be used poorly with this population. I think that any of the modalities can be used poorly if you are trying to have a prescribed outcome. So even as I've been talking about tolerating distress, if you're like hankering down on that, and you're like, you need to use this ACT skill because you need to be, more tolerant of the distress around this because you need to accept your illness, like you are now moving into really dangerous territory. The world of like nonviolent communication and these kind of theories, that's doing harm. It's violence. To prescribe a goal to somebody and then force them into it, even if it's verbal. And even if it's well intended, like, well, I really want to help them not suffer anymore. And I can see the light on the other side of this. It's like, yeah, but your job as a therapist is to move through it with them, not like drag their arm to the other side. And that's the same with parents too. I would give the same advice to parents. So acceptance and commitment therapy is really great because we want to explore our clients' values. We want to know what's important to them, not what's important to us. And then we want to help them learn the skills they need to learn to be able to do hard things, basically. That's going to get them to the other side. But that is so much, it's easier said than done. There's so much to learn in that. It's like you have to learn, well, what is the best thing for them? Like parents might think that the best thing for them is to go to school no matter what, because life is hard and your boss is going to fire you if you're out too much. And so therefore that's what's best for you. And therefore we have to just figure out how to do that. Other people might think that the best way to do it is to stay home every time and like take care of that's like taking care of your nervous system if you stay home when you're feeling this way. And it's usually a balance. It's usually a little bit of like, what is the distress level? What is the symptoms? How do we know where your limit is? Where if you push past that limit, you're going to be in dangerous territory, like a flare-up, a crash, and you'll be down and out worse than if you had maybe just stayed home that day. So there's a lot to explore there, but I really love the values work in ACT, and then the ability to see yourself as separate than your symptoms. Your symptoms absolutely impact your life. We shouldn't try to, again, push that narrative like, well, you're not your symptoms, you're not your diagnosis. I think people can get really hung up on that too, but when people get really, we call it in ACT, fused, when they're kind of enmeshed with their symptoms or their condition, that's typically a protective response. They haven't gotten the answers that they need. They either haven't gotten a diagnosis, or they have gotten a diagnosis but not enough of the right treatment to help them feel better. And so their body or their mind is going on loop trying to think about this problem over and over and over and over again in an effort to solve the problem. It's actually very protective. So yeah, I think we start there always. Like, what is protective about what's happening? We validate that, and then we slowly, little by little, bring in alternative perspectives and ask the client permission, or is this resonating with you? What about this does resonate with you? What about this doesn't resonate with you? And through that, they start to develop their own perspective, their own thoughts, and their own desires for what to do next.
Well, and I am not trained in ACT, but I have kind of followed it as a growing modality, and I love hearing people talk about it, because I do think that there is like so much to be said in terms of like the value piece of like what values are you placing, because the let's face it, the values that your teen is going to put on something are vastly different from the values that you are as an adult or a teen or teacher or like parent, whatever, are going to put on something. That is the piece where I feel like when you talked about enmeshment, I was like, there's so many parents who kind of like fuse this idea of like, oh, like my kid is going to follow in my footsteps and my kid is going to have the same values as I do. But like I mean, I have toddlers. I do not value this empty cup as much as my toddler might.
Yes, that's exactly right. I totally am with you there. I always like to give a Venn diagram exercise. So, parent write down their values, or even the therapist can do this with a client. So, what is the values of the teen, and what is the values of the parent? Or if you're in session doing this as a therapist, you can even use a little self disclosure here as a therapeutic technique, and actually list out your values and have the client list out their values, and then see what overlaps in that Venn diagram. And again, this is just a way to help the teens start to kind of look more closely and realize like, oh wait, you can have something different than me, and that's not threatening. That's okay. We can have two different values, and look, we also have some overlapping values. So what does that mean for me? What do I like about that? What do I not like about that? And this really requires a lot of patience on a parent's part. I know, because like you said, they often just want the child to follow in their footsteps, or they want the child to do better than they did because they were, they want to give their child, and so then they project that onto them and can really, again, do some harm.
Well, and I think too, like there's nothing bad about wanting more for your kid, and there's nothing bad about wanting them to be able to live up to their full potential. The bad part comes to me is when there's a lack of reflection and a lack of like accountability and ownership of like, I want those things for you, but I have to also accept the fact that you may not want those things for you. And so when we're dealing with like a chronic illness and we're trying to support someone, like of course, like I totally get that parent, that therapist wants to be like, I want to see you walk out the door and go to school. Like I want to see you access all these things. I want to see you hanging out with friends. But like, is that really where their value is at that point? Is that what they feel like they're capable of? Are we setting them up to be like totally shut down because I don't align with that? But if that's what your goal is for me, and that's the only standard of success, why bother?
Exactly. Another great like example or technique for parents or therapists then would be to have three different goals written out on a piece of paper: parents' goals, teens' goals, and where are we noticing some overlap in this goal. Teen might want to be really successful. Let's say they might word it, I want to make a lot of money when I'm older. And parent might say like, I want you to be really successful, but yet teen isn't going to school. So now we can examine beliefs. Parent thinks and believes that school is the only option there. Teen, what do they believe? Because it sounds like a mismatch. Well, if you care so much about making a lot of money, you would go to school. Well, maybe not. Maybe they think in another way. Maybe they have a different idea of how they're going to make that kind of money. Now this opens up room for a conversation. And when your teen feels heard, they're going to be much more open to talking about, like, if you're listening to them and how they want to make a lot of money and how they don't think school is a part of that, like, listen to them. And so repeat back what they're saying. And then you can say like, that's an interesting thought. Here's what I've seen, from my life. And here's ways in which what you're saying might work, and here's ways in which you're saying might not work. And that includes, for children with a chronic illness. I think parents become even more scared when the teen has a chronic illness. They don't want to put any stress on them. They don't want to challenge them. They just don't think their kid can handle anything because their kid is in such distress around the symptom. And that's usually just not true.
Well, and I also think, like, going back to what you had said before about how, like, we have been sick since the dawn of time, we will continue to be sick, right? And this idea of, like, we have to be able to navigate through that. If we're essentially supporting the narrative, or we're, as a parent, making the decision to be like, no, you can't do anything until you're healthy, it's really postponing life.
Exactly. Yeah. And that's something, I work with all the time with adults. It doesn't matter the age, that we have to figure out how to keep living our life when we're sick. And that does not mean push through the pain and pretend it's not there. It means that you might have to miss out on some things. You might not be able to go out Friday and Saturday night and then clean your whole house and meal prep on Sunday. You might not be able to do all of that and still be functional by Sunday night. For a lot of us with chronic conditions, that comes with elements of chronic fatigue and other debilitating symptoms. So yeah, there's some sacrifices that sometimes have to be made. There's some adjustments that have to be made, but you should still be able to do something, even if it's 1 millimeter in the direction of a life that you want to live. And that's not done without social support, right? So that's like the biggest piece of it all, is it's not a matter of, well, you should be able to do something in, 1 millimeter in the direction of what you want to do, so go and do it. It's, how can I help you do it? Because as a parent, that's our job. It's our job to scaffold for our kids.
Well, I talk so much about scaffolding in all of my work, because I just feel like it is like the missing piece. And like, if I go back to when you were talking about, kind of like essentially living in the gray, where it's like nothing is truly black and white, and like the flexibility in mind that we're looking for is being able to tolerate the distress of like not knowing, or the distress of like not having a perfect blueprint to like navigate that. But I think the more curious you can be about like what your teen is experiencing and what may help and what not, and use it as like an experiment, right, where like nothing is set in stone, like let's just like figure it out together, let's join in that. And the more almost like micro you break down the problems too, it's gonna feel so much more like tangible.
Exactly. Yeah. And a parent might be listening to this thinking like, I don't have time for that. And I would just argue that you don't have time not to, because you're just going to prolong the problem. And so, I believe you that your time is very limited, and that you're stressed, and the amount of hours that you have to work outweigh the amount of hours that you need to rest in a week. And all of that is true and accurate. But also, can you lean on your community? Where can you ask for help that you're not currently asking for help? We don't really live in communities anymore. We kind of live in these like nuclear family systems in which you're supposed to either pay for all of your help or just do it yourself. And I hate that it's like that. So I work really hard in my own life to go out of my way to ask for help and to give help where I can. Like my kids' school community, luckily, is really great. But that I could see how I could have easily not even like immerse myself in that from a place of like anxious, like from anxiety. So I think it's important to always bring up, the parts that we can't control. You can't control the environment you live in. You can't control, but where can you make small, subtle shifts? And what can you do that's maybe just, again, a millimeter different than what you've been doing?
So much of this resonates, and I know we didn't get really a chance to talk about it, but my whole kind of like, so I use a lot of harm reduction. I love harm reduction in practice because I feel like it feels so much more tangible sometimes than like other models where it's like, hey, in 60 days, you are going to go from this to this and you are going to be good to go. But harm reduction in my like theory and application of it has always been like, how do we move it just 1 centimeter towards like health? How do we move it towards 1 centimeter, 1 step towards this thing that's like a little bit better? When I think about that, I'm like, that is more tangible for me to say like, hey, I'm just not going to have a donut today versus like, I'm never going to have a donut again.
Exactly.
Right. Yeah. And like, I freaking love donuts. Like donuts are part of my family routine at this point, right? It's like, if we want a special treat, we get a donut while we're out. So it's like the idea for me of being like, I can never have a donut again, impossible. I cannot guarantee that. I cannot commit to that. But if it's about like, oh, I just won't have a donut today because I'm doing all these other things, like that is so much more manageable. And so I think like it just ties in together with like the harm reduction piece, and I'm just all these pieces are falling in place to me, and I'm like, oh, all of this makes sense to me with where I'm
Yeah.
at in my career at this point.
Yeah. Yeah. I think that's like, on one hand, chronic illness work is the same as any other therapeutic work we do. And on the other hand, having the specialized knowledge around the medical systems that your child is in is really important. So that's where I think working with a specialist or working with a therapist who really understands the medical world is really important, because then you don't have to sit and explain. Like, you would never have to sit and explain to me like that you've been to 10 doctors and you're not faking it. Whereas somebody else might hear that and be like, well, okay, 10 people said nothing's wrong with you. I think we should start looking at what's in your head now. And it's like, again, 7 to 10 years is the average diagnosis it takes to get one. So, yeah, little things like that.
Well, and I think about then like how intentional and how slow sometimes that process is. And I think that's the other piece where I totally get it, right? We're in a fast day and age, capitalism rules us. There's so many things that are fast, 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 fast results, fast outcomes, fast, etc., fast to the next step. And I think that there is a beauty maybe in slowing down and being like, I am committing to this journey right now. And like, I don't know if it's going to be 7 years or 15 years or whatever, but like, all of those little micro steps, like they truly don't take a ton of time. And I know that there are a lot of parents out there, who are like, oh, I don't have time to sit and have a conversation with my kid, but 5 minutes over ice cream, 3 minutes sitting at the table chatting about your day, right? Like those are all moments where you can infuse those conversations and check in about symptomology, check in about how they're feeling, like whether it's something that you're joint tracking, where there's a board where it's like, I'm going to write down the things that I've noticed, you're going to write down the things that so we're creating systems that are helping us long-term collaborate this, so neither parent nor teen is having to like really hold everything.
Exactly. And like, parents really, I think, underestimate how much those 3-minute conversations like can just really help. And so sometimes I think, they just don't do it, like they won't do it at all, because they're like, well, I don't have like 3 hours to do this. And you don't need 3 hours to sit and listen to how your kid, I think. And also note, like, something I wanted to clarify earlier, when we're talking about your kids' values being different than yours, or maybe their goals being different than yours. If a teen is saying, I don't want to go to college and here's why, and you and your family think it's really important that they go, one, that's a whole other topic about whether they, as a society, that is the exact right way to go or not. But we're just talking about you and your specific family. If they say, I don't want to go to college, school's too hard for me now, how am I going to succeed then? You do not have to go into a conversation about how things are going to be different then, or if they just did X, Y, and Z, school would be easier. If you validate them in that moment, that does not mean they are absolutely not going to college. Validation does not sound like, okay, sweetie, you're right, and you don't have to go. We'll never talk about it again. No, you have conversations week after week, month after month, and you get curious about it. Get curious about their standpoint. The more curious you are, the more they're going to listen to you when you do finally interject with something that's a little bit more concrete and a little bit more like, well, here's what we believe here, or here's what we think is best. Now, that doesn't mean they're always going to listen to you, but they will be a lot more open. They're modeling you. If you have been open with curiosity to them, they're going to be open with curiosity to you. And that might take some time. It will take some time. It won't be right away. So it's just important.
Well, and I think too, like parents and probably some other like teen therapists too, we're kind of guilty of about like buying into the struggle when we've actually just missed the mark. Because there are so many teens I work with who are just like, I feel so stressed about this, like I just don't want to do this other thing. And I think about that for myself as a freaking adult. I'm just like, I don't want to go to the gym. I don't want to have to get dressed and do this thing or whatever. But that's not like a long-term forever thing. That's just like, I need to vent in this moment and I'm feeling frustrated, and like being able to hear and be like, I get you, right? Like school's really hard right now and it sucks, and like we're working to figure out like what you feel like you'd need to kind of have in place to be successful in that environment, whatever that is. Doesn't have to be a long-term, I'm never going to college conversation, because teens change a lot. Like they change a lot overnight, they change a lot over a couple months, they change a lot the more they get to know themselves and the more support they have. So like, I guess, for all the parents out there, like don't buy into those little things, right? Like hear what your kid is saying and be able to validate that without thinking like, oh, my kid is never going to go to college because they told me at 12 they don't want to.
Exactly. Exactly. Yep. I learned that lesson, I think, with my own toddlers, of just, it was interesting like when my daughter was first learning how to really talk and like express opinions about food, and she would be like, I don't like that, and it was like her favorite food. I realized at a certain point her like meant I don't want that right now. She just didn't have the language for it. So she wasn't telling me she no longer likes mac and cheese, but that's what an adult brain would hear. She was saying I don't want that right now. And I mean, how real is that? Like, I don't want mac and cheese every single day for lunch. I might not want eggs this morning and I might want them tomorrow. Like, they're a human just like us. And you're exactly, don't buy into that specific language, that specific problem. But I would get curious with it. Like, oh, you don't like mac and cheese? Like, did you like it yesterday? Yes, I did like it yesterday. And then it's like, it's just, it doesn't have to mean anything more than that.
Yeah. Yeah. And I think that's such an important thing to like point out. It's like these little micro conversations, right? Where you had that in like a minute or two, so impactful for your understanding and for your kids' understanding of how they're being perceived and heard and supported. It's amazing. I had a question for you because I know like I talk a lot about like what my own standards would be if someone wanted to start seeing teenagers in practice, because I don't believe they're just little mini adults, and I feel like they are their kind of own specialty. But I was curious for you because I have obviously, like, we've seen it all the time on the different blogs, or like people are looking for referrals of like who can see someone with chronic illness. And I'm curious from your perspective, if you are a therapist who has not worked with chronic illness before and you're contemplating, is this something that I could do, what would you say are kind of like the bare minimums or things that they should look into, have in place, understand before they take that client on?
Yeah, if you could name 5 biases that you have, you can work with them. If you can't even name the biases that you have, it's not a moral failing, it's a deficit that you can solve and fix through consultation and books and listening to lived experiences on podcasts and YouTube and things like that. But you must know your biases. We all have them. And if you can't name them, then you don't have enough awareness right now.
I love that because I think that there are a lot of people that are like, oh, I'll take this client, they sound great. But like, again, chronic illness isn't that just like side passenger. Sometimes chronic illness is in the driver's seat, and it's like being able to have all of that understanding and knowing that you're in a place where like that is a safe, like you are a safe person for someone with chronic illness, I think is super important.
Yeah, exactly. And yeah, if I can share a little bit about our upcoming conference, that's kind of why we're hosting this. My colleague and I, Victoria Rodriguez, she's a therapist out of Louisiana, and yeah, had been in my consultation group for like 3 years. We really had a lot of the same kind of values and opinions and ways of seeing disability and chronic illness. And so, yeah, when we kept seeing request after request on Facebook pages of, is there any conferences for chronic illness? We were like, let's do this. Like, it's time. And yeah, we will be dispelling every myth. And, we're doing a talk on sex and chronic pain. We have a financial therapist doing a talk on managing money with chronic illness, learning to be a partner to your body, neurodivergence, and chronic illness. So there's a talk for every aspect of a chronically ill person's life. We have one with mental health first aid for chronically ill youth, as well as a talk about the family and being a caregiver to somebody with a chronic illness. So we've covered every aspect, I think, of living with a chronic illness, and specifically for therapists and physical therapists. We have 13 CEs for social workers, counselors, rehab counselors, and PTs.
Oh, incredible. I'm so excited that people are going to have access to that because, again, like we said in the beginning, it's not talked enough about. And I think there's a lot of people who want good information on how do I help support a client? How do I help support my teenager? How do I do this myself? Because it doesn't have to be a hindrance. It doesn't have to be something that like we don't discuss. We can be whole person, right? We can talk about all the things and like really navigate the gray.
Yeah, I agree.
So when is this conference?
It's March 6th and 7th of 2026. And yeah, it's virtual and in person in Atlanta, Georgia.
Okay, perfect. And the virtual option, does it get the same CEUs as the in-person?
If you're live, it will. So you have to sign up and be there live. I may be able to I'm looking for, as soon as my provider status comes in, I will be making it a home study, and you can buy each one separately, but depending on also who agrees to that from the speakers. So a couple of different moving parts there. I can't promise that you can buy each talk individually and get CEs later, but if you do sign up for the conference and you can't make it live for all of the sessions, you won't get all of your CEs, but you will get a replay for just the knowledge.
Okay. So if I attended virtually, and did them live, could I still get the playbacks later?
Yes. Yeah.
Okay. Okay.
You just wouldn't be guaranteed CEs later. So you'd want to make sure you're there live, or just, you could attend 5 of the 8 talks and then only get there. Each talk is an hour and a half.
Okay. Okay.
Yeah.
I'm so excited. I'm gonna go sign up.
Thank you. Yes.
I'm jazzed. I love learning about other like niches that maybe like I haven't spent as much time getting into, and like I know I have a lot of teenagers that are kind of struggling with chronic illness and kind of like intertwined nature with like neurodivergency and stuff, and I want to be the best therapist I can be for them. So, and there's so many things I need to know about it. Even though I feel pretty well acquainted, I'm just like I want to learn all the things.
Yeah, and it's a niche specialty, so really, like, we all need a base level of understanding, but then there's always so much more to learn. Even for me, like, there are people that I'm still learning from. So, yeah.
I love it. I mean, lifelong students.
Yeah.
Right.
Exactly.
So anyone that's listening, you can attend the conference. I will link the stuff below so you know how to sign up and where to go. And then Destiny, I'm also going to share all of your social medias and stuff because I know you put out a lot of stuff that's really helpful for people.
Thank you.
And I'm just excited to kind of stalk your journey, and I'm low-key obsessed. So
I appreciate it. Thank you so much. Thanks for having me on.
yes, of course. So for everyone listening, I'm going to link everything about the conference below. Destiny says that it's March 6th and 7th. Okay. But all the information will be below, and how to contact her if you want consultations. Do you do group supervision stuff as well?
I do free clinical consultation right now, and I will be doing not like supervision where you can get your supervision hours, but I am starting a student and pre-licensed group. So it will be in addition to their supervision as an extra source of clinical consultation, but it will not replace their supervision.
Okay. Okay. Perfect. So, and all that's on your website?
Yeah.
Okay, great. So I'll link it all below. So if you're interested in knowing more and signing up for the conference and learning about everything that Destiny does, the link is below. So
thank you so much.
yes. Thanks again so much for being on the show today. I like really had so much fun chatting with you, and I look forward to watching you at the conference.
Thank you.